Welcome to ICE Webinars, a cool place for hot topics. ICE Magazine is proud to bring our new monthly webinar series to the imaging industry. ICE is the community that directly links nearly 7,000 imaging professionals with a monthly magazine, online community, annual conference, and now a monthly webinar series. Each ICE Magazine issue contains insightful and relevant content ranging from technological advances to new tools and professional development. You can obtain a free subscription to ICE Magazine by visiting theicecommunity.com/subscribe. We are excited about today's presentation featuring Kelly Prey, an enterprise change management leader at Children's Hospital, Los Angeles. The COVID-19 pandemic has only increased the difficulties that we face to successfully navigate change. Kelly will discuss best practices in how to effectively manage change for yourself, your projects, and your team. As organizations evolve their practices to meet the demands of this new normal, leaders must be equipped with the tools and resiliency to help their teams. There is good news. You don't have to reinvent the wheel to make this happen. Today's webinar is eligible for one ARRT Category A Continuing Education Credit by AHRA and is approved for one CRA credit. You can obtain your CE certificate by completing the post-webinar survey. More details on this at the end of today's webinar. As I mentioned earlier, our presenter today is Kelly Prey. Kelly is responsible for building out change management in order to ensure adoption and usage across enterprise initiatives. Amidst the COVID-19 pandemic, Kelly has been supporting the strategy on the organization's response and recovery planning. Kelly, you may begin whenever you are ready.
Thank you. I would say good morning and good afternoon for those of you on the call. I do work at Children's Hospital Los Angeles. So here in Los Angeles, California, it's about 11 a.m. So it's still morning for me. I lead our enterprise change management strategy, and we have that housed in human resources at the hospital. And to just give you a little bit of background, Children's Hospital Los Angeles is a nonprofit healthcare institution. We have roughly 400 pediatric beds and about 6,500 employees. And that's not including, we have an affiliate, an academic affiliation with the Keck School of Medicine at the University of Southern California. And so that's not including those that we partner with our faculty and physicians at our organization. So while I work at Children's Hospital Los Angeles, one of the changes with the pandemic is, of course, the resurgence and an emergence, really, of a remote workforce. And so thank you for allowing me the time and space to present this webinar from my home office. And as such, regardless of the location that you're sitting in, we're all interacting in this virtual environment together. And as such, I'm going to try and make this actually as interactive as possible as we move through today's presentation. I definitely want to allow for discussion and questions at the end, especially because as it relates to change, there's so much variety in size and scope. And the goal here today is to give you all a very high level best practice approach, shared definition of what change management is, and then again, allow for that time for some discussion. So before we jump into it, I wanted to, and again, test this out in a kind of virtual interaction environment. So if you have your cell phones in front of you, if you could text CHLA to the number 37607, it'll allow you to join what is this Poll Everywhere interactive survey tool. And so if you could text it, standard messaging rates apply. And then I'm curious to hear from those of you on this call, what size organization are you currently working for? And whether it's A, B, or C, small, mid-size, or large. And so I'll give a moment to see if that will work. Awesome. We've got a couple responses coming in. So it's looking like the majority of the folks on the call are mid-sized. However, we do have a few participants who are working for a smaller organization. And in these small to mid-sized organizations, that leads me to my next question of the composition of our audience today. And that's, what role do you currently have at your organization that you're working for? And there's a number of different options on this menu, and this will become more relevant as we go through what are really those roles in change management and in change leadership. And just for a differential, some senior leaders are of course going to be managers and supervisors of employees. This is really to differentiate what would leaders leading leaders versus leaders leading frontline staff. We have a nice composition of leadership here on this call. Now we're going to segue into getting the brain starting to really think about what are some words that come to mind when you think about change. And it could be relevant to today, change in general, the pandemic. And this one's a free text. May need a moment to load. Exciting. That's promising for today's session. Constant apprehension. And also, while this is populating and loading, and you can submit more than one word as well, just a reminder that there is a chat too and a chat function available should the texting or messaging not work. Necessary, hard, so we've got apprehension, hard, necessary, constant, exciting, improvement, disruption. You definitely hope that change is for good, right? And that changes are for an improvement. And that they, a lot of the times it is for an operational necessity. We've got some opportunity, evolution. Now they're really starting to come in. Reducing waste, it's separated into the word cloud, but I gathered those together. And so next I want to move into allowing you all the space to start really thinking about, you have these buzzwords, right? Resistance. We're going to get into a little bit of resistance today as well. And that's when you're thinking about your organization, what are some of the largest changes that you're experiencing? It could be, I know for us, one of the largest changes that we're seeing as a result of the pandemic, as I mentioned at the beginning of this call, right, is remote workforce, especially in healthcare. What does that look like? New workflows. Just think about what are those projects that you're on right now or that you're leading your team through that are causing the most disruption, to use one of the words from the last slide. Thinking differently. And I'm putting words into this person's mouth, but thinking differently in all aspects, screening patients, thinking differently in how we deliver care, how we engage our workforce, how we interact with patients, a new department, especially with leaders. Are you inheriting new people? Are you hiring new employees? Are you seeing transitions in the composition of your workforce, telehealth, EMRs across the system, childcare issues? That's a big one that we're facing as well. Never really in the recent history have those that are working now been faced with working and parenting in the same household at the same time, especially at least for us in Los Angeles. Schools are still closed. So definitely a struggle. And you'll notice with these too, we have being able to backfill critical positions. It's a variety, right? It's not just technological changes. It's not just workforce changes. It's not just patient care changes. It's all different types that really, as I'm seeing this list, I think all of us can potentially relate to, if not directly, then at least indirectly. Employee morale, right? How do you inspire people amidst really the saturation of what we would say is, I wouldn't even categorize as a change as much as it is a crisis. And so keeping in mind these changes that you all are sharing in this format, hold on to them as we walk through these findings and these best practice approaches. Before I jump into that, I will say that Children's Hospital Los Angeles does have a license agreement with Prosci. It's a research-based change management institution. And so a lot of the research that I'll be sharing with you and that we'll be going through is based off of those findings. And so you'll see that as we work through this. Scared staff members. When we talk about resistance and when we get there, fear is such a main driver of why employees resist change. Fear of what they do know and really fear of what they don't know as well. So jumping into it, when we think about change in theory, I'm probably some of us or most of us on this call have been familiar with the productivity dip as it relates to change, and potentially even an engagement dip as people get used to the idea of a change that's being introduced. And so, with any change, all of us on this call should expect a decline in productivity and a little bit of increase in resistance. Now, change in reality, we're not going to just have this little dip and then all the way back to status quo. The degree of the change impact is really going to vary depending on the management of the change itself, the impact the change has on different departments and different groups. And you can kind of see with this flight risk model where your risks are, right? So when you start to have that productivity dip, that productivity loss, it usually often goes hand in hand with also employee dissatisfaction. And without proper mitigation or management tactics, you may start seeing yourself dipping down into Department D, that's when you're going to have that flight risk, right? The flight risk of employees leaving the organization, really tangible customer impact, which for most of us on this call, right, those are our patients that we serve. And you may even really start seeing such active resistance that your employees are actually opting out of the change, which then, of course, lessens whatever the operational impact was intended for that initial change. Biggest takeaway from this visual is just to be mindful that you could have the best possible solution. It could be best practice, most effective and efficient process introduced to your team, and you still might land in Department D. And that really has to do with the ability to bring your people along the way with what you're introducing. And so while the project delivery can excel, without that change management, you're not going to be as effective as you would have been. Now, the good news is that you don't have to be stuck in Department D. There are different tactics and different ways to engage in your teams to be on the upswing, as you see in Departments A, B, and C on this visual. And so when we think about what is change management, it's funny, before the pandemic, I would say, oh, I work in change management. And a lot of times I'd get a blank look on people's faces. And so my elevator speech is the people side of project management. But a more enhanced elevator speech is it's really the process, tools, and techniques to manage and mitigate the personal impact of change to achieve required business results, operational outcomes. So change management, the goal is to mitigate the impact. The goal isn't necessarily to make changes happen quicker. The goal isn't necessarily to, have everybody want to jump into the change, because those aren't realistic goals. A lot of the times, the change that we're dealing with, it's a word somebody threw out when what they associate with change, and that's change is hard. And so to expect your employees, especially the more complex, the more impactful a change will be on your staff, it's not realistic to expect for yourself and your team to want and be increasingly engaged around the change. What's a more realistic goal is, how do you as a leader mitigate the impact that the change is going to have on your team? And we'll get into some of those approaches. And so with change, you have a current state and a future state, right? Here to there. And a lot of times in leadership, we look at changes almost like a light switch, right? Here's where we are today, and there's where the change requires us to be. And we lose that transition state. And the transition state is really what causes the most fear, the most discomfort, really the most impact to your team members. And it's how, as a leader, do you recognize that there's micro transitions between the current state, letting go of the current state, moving into a transition, so that employees can learn, become aware, get the training needed so that they are fully prepped, ready, and bought into that future state. And you do so on two levels. You do that on the project management side, and you do that on the change management side. And to kind of further differentiate the two, the project management side is the deliverables, right? This is the budget, timeline, project charter, business plans that move us from the current state to the future state. And again, as we saw in that flight risk model, you're only going to be successful with these projects with the people that you bring along the way. And some of the tools, so if it's the project management side, you have the business case, the timeline, deliverables, charter, budget. With change management, think of stakeholder analyses, communication plans, training plans, so that the people are really equipped and able to successfully navigate and execute what's being asked of them. And if you're looking at your projects and you're looking at your organization and you're thinking, how much project management versus how much change management is needed? And that's really when we get into the variability in change. And it's really going to depend on the complexity of the project or change itself, as well as the complexity of the impact that it's going to have on your individual team members. And so with project management, it's really going to depend on the degree of the change to the process, the systems, organizational structure, budget, timeline. With change management, you want to think about how much disruption is this change going to create in my team members' day-to-day work and environment. And we're going to get into a little bit of how you even pull that apart further, because I think a lot of the time, and research has shown, when leaders reflect back on changes that may not have been as successful as they would have hoped for. It's because they underestimated that disruption and they underestimated the impact that is on the individual level when these organizational changes are introduced. And before we really jump into weeding through what that looks like, did want to pop in a little pop quiz. And that would be, who are the groups that you on this call think are most likely to resist change at an organization? So if you're looking at the composition of your workforce, who do you think are the most likely to resist change? So getting a couple answers sprinkled in, but predominantly the guess of our participants is we're going to see that resistance from our frontline staff. And as I said, we've partnered with this organization, Prosci. They've done about 20 years of research, 10 longitudinal studies. And this question is asked and posed to thousands of organizations across different industries. And in actuality, the group that's most likely to resist change are those direct managers and supervisors. And based off of, the intake that we had on the beginning of this call, the groups that are most likely to resist change in an organization are oftentimes us. And I was surprised when I learned this. I would have said frontline employees before learning this information. And so let's talk about why that might be. So when you look at roles and change, let's move directly to those middle managers and direct supervisors. So their role as leaders is they're coaching their direct reports on the project. They're the ones that are ultimately responsible for directly leading their teams through change. They're the ones that really want to communicate what does that personal impact look like, right? That disruption from the previous slide. What does that look like on an individual level? What's not on this slide, and what I think many of us often forget, is we deal with change first as people. We deal with change first as individuals, and we ourselves have to navigate the changes that are being thrown at us, while also oftentimes simultaneously, not necessarily in sequential order, lead our teams through it. And so it's that dual role, it's both hats that we constantly have to wear that adds to that resistance in change. And now when we differentiate, and we add differentiate some of the roles between what does that look like for a direct leader versus those that have more of that executive or senior leader role. So this would be leaders of leaders, or more, for those middle-sized organizations, those that oversee maybe multiple teams and departments. They're, instead of actually directly leading individuals through the change, they're more likely going to be sponsors of the initiative. They're going to be communicating that big why, the big business case for the need to change. And what's really interesting is that when we think about that sponsor role, is when Prosci did all of this research, they studied what was the X factor that made projects more or less successful. And you can kind of think in your mind, when I think of change, what do I think is the X factor that really will make or break a project? And through these 20 years of research, they found that the role of the sponsor is actually the one that's really going to make or break a project. Is the sponsor really actively sponsoring the change that's being asked? Or are they doing it in a passive role where, sure, I sponsor the initiative, I'll sign my name on the dotted line, but they aren't actually actively and proactively being in front of the change, communicating the business case, leading leaders, supporting those leaders who are having to lead those direct reports through the change. Switching gears, you have those project-based roles in change. That's when you're going to get your change management resource or team. If you have complex projects, you may have a project manager or a team. And then there's support functions, which provide the subject matter expertise, especially when we think about those technology changes. Now, you don't necessarily need a separate individual for each of these roles. And conversely, you may not have just one person who's exhibiting everything being asked on the project-based side. It's more just to be aware that these hats need to be at the table. And if people are wearing more than one hat, especially in smaller organizations, especially on smaller scoped projects, that's not going to impact necessarily the opportunity for success. Again, the biggest thing that's going to impact the opportunity for success on a change is active and visible executive or senior leader sponsorship. So we're going to do twofold in findings. We're going to think about organizational change, and then we're going to talk about individual change. And when we think about organizational change, a lot of that is rooted in culture. And culture at the highest level is our mission, vision, and values, right? Who we are and what we do, where are we going, and what do we believe in? And what we often lose sight of is that culture is a lot deeper than just the mission, vision, and values of an organization. And there's multiple layers that are going to impact the amount of management of the changes required of an organization, depending on how complex those layers go. I love this graphic from its consultant Torben Rick, and it really highlights that most often in our efforts and our awareness really only scratches the surface in our management of the impact and change. Really beyond just the mission, vision, and values of an institution, there are shared beliefs, there are traditions that really add complexity to the impact of change. And I think one thing too that as a change management professional I hear, and there's what should be and there's reality, and that's the storytelling and the stories we tell and the gossip. It's, we should ignore gossip when we're implementing these changes. And the reality is that these stories and these feelings, they're not necessarily validated, but they're going to be impacted by the changes you're introduced. Humans are great storytellers, and when we don't know something, we like to fill in the gaps with our own knowledge and our own story. And especially right now, there's so much we don't know. And if you're not actively and proactively, I would say, addressing what those stories are and replacing them with facts, or very concretely replacing them with what we truly don't know, which in this pandemic, in this environment, again, there's a lot of that. Those stories may end up having the biggest impact when it comes to resistance, when it comes to managing those changes. With feelings around those stories, we work in healthcare. We attract employees with high altruism, sensitivity, caring, and people really care about the personal impact that either things have on them or that the work they're doing has on others. And so as a leader and as a manager, needing to be aware and navigate that and having those conversations with your team. And so we're going to transition from the organization to the individual, because when we think about organizational change and when we think about organizational culture, at the end of the day, the organizations aren't changing. It's each individual within an organization that is responsible for executing the change. And when we think about what that looks like at the individual level, it's not just an office move or a change in job title. There's so many different facets. Again, going back to that slide of the amount of change management needed is based off of the amount of disruption Well, you may think somebody moving 3 offices over down the hallway, when we think about looking at this, it's the location, right? That might be a minor move, but they may be moving right next to someone that they may really struggle to work with. And that's going to be a huge disruption to the mindset, attitudes, beliefs, and critical behaviors that are featured on this slide. And so, again, through conversation, through feedback, through dialogue with your team members, it's really important to understand which aspects of your people's jobs are being impacted by the changes that are being introduced. And coming back to this idea of the current transition and future state, when we think of it at the individual level, we want to think about what do those transitions look like? And change is situational, right? It's here we are, here's where we're going, and here's what it's going to be here's what's going to take to get us there. But individuals have to go through this process of where they let go of their current state. They have this ambiguity and fluctuation in a transition state, and then they start to take steps in that future state. And so for us as leaders, what are some of the best practices as it relates to us leading them through these transitions? And so going through just a high level again of some of the best practices, identify who is losing what. So when we think about that wheel of all of the different impacts on a person's job, identify which aspects are impacting who. Acknowledge it openly and empathetically. What you really don't want to do is gloss over the impacts that a change will have on your employees. And if there is one thing, like my big soapbox preaching takeaway to have from today's session, it is that resistance is normal and a natural occurrence in change. And that for us as leaders, and just in general for change practitioners, the goal of change management is not going to be to eliminate that resistance. The goal, again, is the word to mitigate and to manage that resistance. Because sometimes we get resistance, and resistance is feedback. And that feedback can actually help us improve whatever is being introduced so that it's an even more optimal solution for your organization and your team. Another best practice tip or trick is that research shows that employees have to hear something 5 to 7 times for it to stick once. So 5 to 7 times for it to stick once. And that's just to even recall what you said, let alone to actually comprehend, understand, and take action around what's being introduced to them. And so that's where the little plus comes in of repeating messages 5 to 7 times at the bare minimum. And this doesn't necessarily mean 5 to 7 emails that you send to your employees, right? Find different ways and different methods in how you communicate with your team. Similarly to identifying who is losing what, really outline the scope of what is and what is not being lost. Very similarly, it's being very concrete around what we do know and what we don't know, what is in scope and what is out of scope. Creating that very black and white binary categorization of change really helps people when they're dealing with that transition state of ambiguity. Treat the past with respect. It's interesting. I hear about this was not my generation, but moving to an electronic health record and losing that the paper trail, so to speak, of patients. It's easy for somebody like me to come in and say, oh, that's such an archaic way of doing things. This way is so much better. And that's not going to be the most effective way to lead your employees. through, even if you know, again, it's the best practice, most optimal and effective solution, you still want to respect the way that things were before and the way that your employees did things before. And then lastly, this is a little bit more nebulous in nature, but allow people to take a piece of the past with them, whether that's in the form of nostalgia, or maybe there's a small compromise that you can have in an introduced change or new way of doing things. Just again, having that respect for where your employees are coming from as it relates to the impact that changes or that growth or that new introductions are having on them. And all of these approaches are just going to help you as it relates to when we think about resistance. And some of these are proactive in nature, right? So maybe you can mitigate the amount of resistance you're going to see. I'm going to close out sort of more my didactic portion before we get into the questions and hopefully some meaty discussion, which is, when you're experiencing resistance, what are the approaches that you as a leader should take with your team? And I like to think of things in threes. Actually, research shows that adult learning, we remember things in threes more often than any other combination of numbers. So I'm providing you sort of two things in threes. And one of the best approaches for when you're experiencing resistance with your team members, first and foremost, get ahead of it. Ask for feedback, right? Resistance is normal and natural, and so we should all expect it from our teams. And so we shouldn't be afraid to ask for feedback on what's being introduced. Oftentimes, I think, especially us as leaders, we're afraid to ask for feedback because we're kind of afraid what to do with it when we receive it. But by asking, it's showing I respect your opinion, I respect your input. Once you receive that feedback, acknowledge it. Acknowledge it either in the form of repeating it back to the person to make sure you've captured it correctly. Thank them for providing that feedback. And then you're going to want to explain why you can't necessarily do what the feedback or what the questions are being asked. Explain why this change is needed. Explain why now, why the team is impacted. Explain the WIFM, the what's in it for me, and then the worm, which is what's required of me. And so I'll move into that in just a moment. But again, in the vein of repeating things 5 to 7 times, when you are introducing a change to your employees, always ask for feedback, acknowledge the feedback that you receive, and then explain, and again, things in threes, the why, the WIFM, and the worm. And so when we think about the why, the WIFM, and the worm, so you have the why. Why are we making this change? For us in healthcare, I always say this is where you do go back to your mission, your vision, and your values. Regardless of the size and scope of the change, I always try and thread the needle as much as possible from what's being asked of my team to the delivery of care to the patients we serve. A perfect example of this is we in human resources had to move offices, and our move took us to an off-site office further away from the hospital. And the why was because about 40 different teams or 40 different departments were going to do this domino effect of moves that would ultimately result in us increasing our pediatric ICU unit bed. And so the why that we had to move was so that Children's Hospital Los Angeles can take care of more patients. And that's an easy connecting the dots of, okay, it's inconvenient for me to maybe walk 3 more blocks to the hospital when I have a meeting. However, that inconvenience is offset by the impact that this change has on our mission, vision, and values. What's in it for me? Some of us may have heard this on the call in previous change management or change discussions, is identifying that benefit, identifying the WIFM, the what's in it for me. And in order to really identify this too, you got to know your team members. You got to know what drives them, what motivates them, what inspires them, so that you can connect the dots for them when a change is being introduced. A lot of the times, what I hear in change, especially hard change, is leaders have a really hard time of finding the benefit, right? Oh, this is gonna increase their workload, or oh, nobody's gonna want to opt into this. And again, bringing back to what I had said earlier, the goal isn't to necessarily have your employees all raise their hand and volunteer for these changes that are really hard and maybe increase workload and maybe bring a little bit of a productivity dip or dissatisfaction. It's to mitigate the impact. And one of the ways you mitigate the impact is by creating and enabling your employees to have autonomy in the change. And so you can outline as much as possible what the benefits are, what's in it for me. And then I'd say do that hand in hand with what is required of me and connect it to the why. And I'll provide an example in just a moment. But a lot of the times when employees fear change, it's the fear of the unknown. And a lot of the fear of the unknown is not knowing, not understanding, and again, making stories about what is actually going to be required of an individual or of an employee as it relates to the change. And so by saying, yes, what is required of you, you are going to have to, I'll actually just use the move, for example, what's in it for me. I can say I like to exercise, and so I'll get more fresh air by walking to and from the main campus. But what's required of me is, I'm going to have to schedule out my calendar a little bit differently and take some more time to walk to and from in a move. The why is, again, so that we can treat and see more patients and provide healthier futures for the children we serve. And so now I know what's required of me. I know why we're doing it. I feel more empowered to opt in and make the decision to participate and engage in that change. So again, when you're introducing a change, ask for feedback, acknowledge the feedback, and explain the why with and worm. It's easy to remember because it's all an alliteration. Why the team? Why the change? Why now? What's in it for your employees, and what's required of them to decide and engage in that decision. And if you yourself don't know the answers, so going back to the fact that we all are undergoing change first as individuals before we are as leaders, ask these questions of your leader. Start to open that channel of communication so that there is transparency and there is productivity in moving forward and taking actionable steps if and when, I shouldn't say if, I should say when resistance to change occurs at your organization. So I'm going to pause there and move into any questions or discussions that those on the call may want to have. I've put my contact information on this slide. Please, following this, if we didn't get to something that you are really hoping for, or I said something that sparked more questions in you, please feel free to reach out. I always love thought partnering and appreciate feedback and dialogue.
Thank you so much, Kelly, for a fantastic discussion. As you mentioned, we do welcome questions from the audience. In order to ask a question, please use the question feature on your GoToWebinar dashboard. A few questions have come in already, but we will be able to take a few more, so feel free to ask those as you wish. Our first question, Kelly, is what do you suggest for when employees refuse to participate in the change?
So again, when we see resistance, if you're asking for feedback, you're acknowledging it, you're walking them through it, and at the end of the day, they're still not deciding to participate, there's a couple tools up your sleeve you can pull out, and this is where, conversation above anything else, And with that conversation, though, this is sort of the tough side of leadership. As much as you want to demonstrate the benefits of the change and highlight and reward and recognize those that are opting in and doing it well, it also comes with the two-sided coin of accountability. And if at the end of the day, this is an operational requirement, you've done your due diligence of mitigating or attempting to mitigate the resistance of your team, then you do need to demonstrate what those consequences are if and when employees aren't going to participate. And the size and scope of those consequences are obviously going to be dependent on the size and scope of the change that's introduced, your team, your policies, your partnership with either other leaders, human resources. But I think that's at the end of the day, it's the whole you can lead a horse to water and you can't make them drink. That's when you will have to have that other side of the coin, and you will have to demonstrate not just the benefits and the rewards, but also those consequences.
Great. Thank you so much. Our next question is, how do you suggest involving employees in change when oftentimes decisions are made at the executive or at the senior leader level?
It's a question I get a lot, especially when a lot of employees want not just transparency, but they want a voice. And they want a voice in what's happening and what's being asked of them. And one of the best ways to mitigate that or to manage that is a lot of the times we have the what, right? We have the decision that's made at the executive level, or sometimes we ourselves are the ones that have to make the decision. And we either have to do it so quickly that we can't gather feedback or sensitivity. We have to make that decision and then introduce it to our employees. And one of the tactics that I would suggest for those on the call is, you as the leader, you focus on the what. You focus on the decision. This is, in scope and out of scope. This is not changing. This is what we have to do. But invite your employees to have input, to have feedback, to come up with, how are you going to get there? So you may be transitioning your electronic medical record system. And you may have the company already selected. You may even have the exact date when that transition is happening. But there are so many facets to the how you get there, right? So many facets to that transition state. That's where you can really invite and engage participation, input, and autonomy with your employees.
Perfect. Okay, our next question is, what's been the hardest transition for you in dealing with COVID-19 at your organization?
It's been a lot. It's been a lot of, I love whoever said thinking differently. I think that just applies to so many different facets. I think the one thing, though, that's been really difficult, and to use that language on an individual level as well as on a leadership level, is the amount of unknown. And when I say the amount of unknown is I think so many of us are used to somebody having the answers. And it's almost, it's funny, actually, I was having this conversation with my leader, and this was right around when, at least in California, things were looking to really open up in July, and instead they shut back down again. And it was this really quick, almost like a week transition for, okay, we had this whole plan to slowly open up, and now we're closing down again. And what does that look like? And building the infrastructure for it. And we were saying it's almost like the moment you realize that your parents aren't perfect is this moment of realizing that truly we don't have all the answers. You're looking to your leaders, you're looking to your executives, they're looking to not just the government, but to researchers, right? And what the research is saying. And there's still so much being discovered about coronavirus, about the pandemic, about the antibodies and the vaccines and everything. There's still so much that we don't know. And I think that's really been the hardest transition is getting people used to that paradigm shift, that there really truly isn't an answer. So what do we have control over and what can we act on today with the information that we do know?
Great. Thank you so much, Kelly, for a fantastic presentation. A quick reminder to the audience that you can obtain your continuing education certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 continuing education credit, and you will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, please contact us at webinar@mdpublishing.com. ICE Magazine is proud to bring you our new monthly webinar series. We will present a free monthly webinar for the remainder of 2020. Our upcoming presentation will feature Terry Bedard of Revenue Cycle Incorporated. For more information, please visit theicecommunity.com/webinars.